Right. So welcome everyone, and thank you for joining us today for basic conditions for the transport of vitrified specimens. Today's webinar will be presented by Dr. Dunya Bastun Post, the Assistant Head of IVF Laboratory at University Fertility Center, Düsseldorf, Germany. Dr. Dunya has many years of experience in human embryology and is very well published. We're very excited for her to present on the transportation of vitrified specimens and discuss the specific conditions and steps that should be taken to help to ensure their intact transport and storage. If you have any question during the webinar, please feel free to type them into the Q&A chat box located at the lower right-hand side of your screen. Dr. Dunya will be answering the questions following the conclusion of this presentation. Now I'll hand things over to Dr. Dunya to get us started. To you, Dr. Dunya.
Thank you very much, Manal, for the kind introduction. So good afternoon, everyone. And I'm happy to talk about the basic conditions today because I think the transport is really important and especially important for the vitrified specimen. So these are my conflict of interest, just to show you. And I think first of all, we should start with a small breath because how do you think a perfect transport should look like? And then I will show you my agenda. So I'm going to talk about vitrification and glass transition, and then about the main features of liquid nitrogen containers or tanks and the monitoring and the storage in general, followed by handling, storage and shipment, and then especially about the shipment of vitrified specimen. And of course, at last I will talk about some pitfalls we experienced in the past. First of all, vitrification. So how do we define vitrification? It's the solidification of a liquid without any kind of crystallization and resulting in a glassy object and a morph object. And how can we just achieve this? We need a rapid cooling, we need high concentration of the cryoprotectants, we have a minimal volume of the cryo solution, and we have special devices where we put the specimen. We have no equilibrium, just to compare it with the slow freezing, and the biological molecules, they remain in the native state. So we have no osmotic imbalance there. What's the main point about glass transition? So the tissues and the cells just contain a lot of water, and that's why the glass transition temperature of water is really, really important, and that's about minus 135 degrees Celsius. And that's the point we need to stay below this temperature. So the specimen will stay intact if we stay below minus 135 or minus 140 degrees Celsius. Just to remind you, liquid nitrogen on itself by physical features has a temperature of minus 196 degrees Celsius. But what happens if a sample is heated above this glass transition temperature? There will be cubic ice crystals formed in the water, and these will destroy the sample, so it will definitely get damaged. What about the features of the liquid nitrogen containers? I think all of you know your container in your center, but we all have a different number and different sizes of the cryogenic tanks, the most of us between 30 and 70 liters capacity. It's advisable to have one spare tank, so a tank without samples or with enough free space in order you need to rearrange your samples. I think, yeah, hopefully you can, or you have a automatically fill of the containers, or perhaps still hand-filled tanks. And the monitoring of the cryo tanks, just as seen here below, is very essential for the safety of all cryopreserved tissues and cells. There are different ways of monitoring the containers. So perhaps you have an automatically system with sensors or probes to detect the liquid nitrogen level or the temperature. And just remember to have a battery or a power backup. You can also measure the weight of the tank or the temperature of the outer surface of the tank in order to detect damages really early. We can also measure manually, and it's important to have a daily visual control, just as seen here in the picture, to detect any kind of condensation or frost on the outer surface. We all know we can store the specimen, so the tissues or the cells, in a saturate vapor phase, and that's just in the tank. And the temperature is between -140 and -180 degrees Celsius, depending on the distance to the surface of the liquid nitrogen. And we have the storage in the liquid phase for about -196 degrees Celsius. Meanwhile, all the manufacturers give lifetime sets for the containers, but you need to keep in mind that there's also a functional lifetime, because you move the containers and perhaps there might be also a damage by filling, for example, manually. The biggest risk really is that the liquid nitrogen get evaporated, and there were 2 worldwide incidents about 3 years ago in San Francisco and in Cleveland that were reported for IART clinics, and a lot of their embryos and major oocytes got thawed at that moment. And that's really the biggest risk at all. I think perhaps that's the first time you see the inside of the tank. So let's talk about the insulation and the construction of a nitrogen tank. We all got an inner vessel, and here are the containers. And there is a lot of multi-layer insulation in the vacuum and the outer shell. And there's a top or a plug at the top. And this is some kind of a transport container. So looking similarly to that. And perhaps, yeah, this is the insulation. And yeah, just exciting to see the inside of a nitrogen tank at all. I found some data about a cylindric tank, and I will show you this data. It's a tank with a diameter of 50 centimeter and 1 meter height, so typically for our centers too, with a filling level of 80% at 1 bar pressure. And the data show that the more insulation you have, there will be less evaporation of liquid nitrogen or of nitrogen at all. And if you just have a distance between the liquid surface and about 10 centimeter, you will lose your temperature. So you will lose about 15 degrees Celsius. And if you lift it for about 20 centimeters, you will have about 15 to 20 degrees Celsius below 196 degrees Celsius. So it's still in saturation, but you just need to keep in mind that there is a loss of temperature. There are many confounders regarding the handling, the storage, and the shipment in a center, and these are just some points I would like to pin. So we all have got a different number of staff and different training levels, and we've got data registry, for example, and perhaps a different frequency of handling and shipment. There are also regulatory requirements with a different number of cryogenic tanks, different techniques regarding labeling, different transport companies. We always need the patient's consent. We have to keep in mind to have enough cryo equipment and shippers and safety equipment, an ambient working area with ventilation and with an alarm system. We have the quality control and the risk assessment in order to avoid any damage to the specimen, and we need to have the access to liquid nitrogen. I think there are really more points, just to show you some of them. Looking at the cryo labeling, so there are cryogenic labels available at the market, and we should put there the name and the date of the cryopreservation and the specimen, especially the number we freeze, and if possible, if there is enough space, the type of the specimen. So if it's just an M2O site or embryos, or perhaps differ into blastocyst or day 3 embryos. And perhaps you work with a witness system and you can put there a barcode or witness label. Yeah, why do we perform transports? Because, yeah, patients move and patients switch between centers, and especially patients who just freeze their eggs, for example, 10 years ago, they will now work in another city, for example, or another country. There are some centers that are specialized, for example, PGT techniques, so genetic techniques. We also work with donation or surrogacy, if it's legal in your country. So surrogacy is prohibited in Germany. And some of us work with central cryobanks. And there is also an increase in the cryopreservation and the freeze-all techniques and freeze-all cycles in the US as well as in Germany too. Now I'm going to share you some more detailed information of our system. So we've got a dry shipper in the center, and there is a special absorbent material inside. So we have no hazardous transport, so working with the absorbent one. But what is important about the absorbent material is that you can't have a quick load. So you need to be prepared for transport. You need to load it once up to the neck and then wait for 15 minutes so that the absorbent material can just absorb the liquid nitrogen. And then you have to repeat these steps for about 3 or 4 times. Then you should leave some liquid nitrogen in the shipper and check the weight. And just prior to the transport, decant the liquid one, check the weight again and the temperature too. So these are the technical data of our shipper. So it's just a small size shipper, and it can absorb about 5 liters liquid nitrogen. And according to the instructions, there should be an evaporation of about 0.13 liters per day and a holding time of about 23 days. And we have an empty weight of 75 kilogram and full loaded of about 11.3 kilogram. But first of all, when we bought this shipper, we tested it. And it's really important to test the shipper just to be sure about the qualification and about the quality of the shipper, and yeah, to have data about this for your data assessment. So we started with about 11.3 kilogram shown here, and the temperature is always about 160 degrees Celsius in the system. And then we just waited for about 2 weeks. And so I will show you here data for 9 days. And you see that we have a loss of about 1 kilogram here per week. So we know that there are, or it should be the same, just in the instructions, to have about 20 days remaining for the transport if it's just at maximum. And you will be safe that the temperature is still below minus 140 degrees Celsius. Next, as the number of transports just increased, we started to design protocols. And this one, I will just translate it for you. contains the name and the date of birth of the patient, phone number and email to contact them. And here we can just tick if it's an import or an export. And we also note if it's our shipper or if it's the other center's shipper, which center is going to be the one, and the transport company, the date of the transport, the specimen, and the number. So you see here 2PN or blastocyst or oocytes or human sperm or tissue. And the number of the straws or tubes that should be sent there. And then we've got a lot of documents. There is, for example, the statement of acceptance and the contract on cryopreservation in case we import the specimen. Perhaps you have a rental document. You need the serology of the patients. And in our case, we need HIV, hepatitis, and HTLV. For example, you can also send the analyzers in case you send sperm or testicular tissue. And we've got a fixed protocol for the transport I will show you next. And information concerning the shippers. So we send, or if we send our shipper, then the other center will get information about how to handle this shipper regarding weight and so on. So we've also got a questionnaire in case we just import samples. And these are really or nearly the same questions. So first of all, it's just the acceptance of the specimen of the patients, and then we ask to give us more information. So which specimen is going to be imported, the number, the procedure, the cryomedia, and the device or goblet that was used. This is our transport protocol. So again, we give information about the material and the female and the male patient, for example, in case of 2PN and embryos, and which method and date, and so on. And we also ask the other center after return to send us the information. So was the seal intact and did the samples arrive well? So how do we perform this procedure? So if we got a transport and now we are 2 days before the transport, we start loading the shipper in case it's not done before. Transport day -1, then we are going to control the temperature and the weight of the shipper again. And in my opinion, a temperature logger is recommendable in case you're going to send samples that might last more than 1 day to arrive at the other center. Or, for example, also if you work together with central cryobanks. And I think that's very important to never work alone. So be sure to work with the 2 persons to be sure about the safety and the identification of the sample. And prepare all documents before the transport. Now, what is really important about the vitrified specimen is just the movement. So be sure not to warm the specimen at all. So handle them properly, and because you might not notice the damage, but you will see it in case you thaw this. And be sure not to compromise other embryos in the same canister or other oocytes, for example. In general, we've got 2 steps of movement. First of all, from the vitrification vat or box to the storage tank, and then the moving of the device from the storage tank to the shipment tank. in case of a transport. And always think about the safety equipment. So how do we perform the transport? Moving the device. Again, don't work alone. And we prepare a new cane, shown here, and a new goblet, and put them in the liquid nitrogen in order to cool them. Then we load the vitrified specimen that should be exported in the vat with the liquid nitrogen and in our first goblet here. And then we cool down another goblet. So it's the pink one in this picture. And then we fix the second one above the first goblet in order just to avoid a dropout. And the dropout might happen during the transport or during the reloading with liquid nitrogen in the other center. So after the shipment. And this is our little note we always handle with exports. So we put the note on top of the tank and say, attention, and please fill the container up to the top with liquid nitrogen before you handle the samples. Because in this tank you have got a satured vapor phase, but in case you lift the samples, you don't have any satured vapor phase at all, and you work at room temperature. So please, first loading, and again, don't work alone. Fill the shipment tank and avoid the splashing so that the specimen might fall out. And then load a vat or a box with liquid nitrogen. And it's always advisable to have a stock of different vats or boxes in different sizes. Then remove the cryocan and that goblet. Control the documents. Detach, in our case, the second goblet because it's empty. And then check the sample, check the name, check the number of specimen, and store it according to your storage system. And then respond to the transport protocol. Again, because it's really, really important, avoid every step of warming. And I also attached here the data for a tank. So this is the top of the tank and 2 centimeters or 1 inch below the top of the tank. And there we have minus 22 degrees Celsius. But if we just lift the sample out of the shipment tank, we've got room temperature at all. So then we will warm this specimen, and that's really a damage. Yes, last but not least, the pitfalls. So these are the pitfalls we experience in our center. And yeah, for example, transport might not be scheduled at all. And yeah, the staff then is confused about that. And you don't have any documentation regarding the patients or any serology, nothing. Or in case the documentation or the serology is not complete, then you start to phone the other center. Or perhaps your liquid nitrogen storage tank is empty or nearly empty, but the shipper should be returned because it belongs to the other center. Sometimes it happens that the labels detach, so be sure that you have cryogenic labels that work more than 1 year. And there also might be a delay in the shipment. So sometimes we wait about 2 days for the shipment to arrive. And yes, it happened yesterday. So yesterday, the transport company just shipped it to the other infertility center here in Düsseldorf and didn't inform us. So we waited for this transport to arrive and it didn't. And we needed to pick it up. And that might happen too. There might also be problems with the customs office in case you export abroad. And if you check the labels upon arrival, there might be changes in the surname too, sometimes because of marriage or divorce or in case of transgenders. So please be sure to have all documentation regarding the patient. And what sometimes happens is that really vitrified specimens have got or are transported in impermeable goblets. So you lift the goblet and you think it's just tight, but it isn't. And then you will lose your liquid nitrogen again. Or one time we had to transport and the vitrified specimen were put in cryocassettes for slow freezing. So it was really hard to get them out of there. And I think you all know some pitfalls too. And yes, I think we all should take care for our specimen, for our organs and tissues to arrive well and to do the best for our patients. Thank you very much for your attention.
Thank you. Thank you very much, Dr. Dunya, for this enlightening presentation about the transport. We will take the questions. So there is a question. Can you please comment on the safety differences in the handling of open versus closed devices system?
Yes, I think in both cases we should just handle them the same way. So always stay below minus 140 degrees Celsius, either if it's open or a closed system. So there is no difference.
Right. So there's no difference for handling the transport for whether they are open or closed.
No.
Right. So I actually have a question about the. Do you think it's helpful if we enclose some of the when we prepare all the documents? If we enclose some pictures of the embryos or the stage, or also the grade used in that center about the embryos to be sent with the documents?
Yes, you can do it and then indicate the system you use. So the scoring system you use. For example, if it's Gardner system for blastocysts. Yes, and we do it for blastocysts. So we send, for example, B3AA or B4AA and so on. Yeah. And pictures, yes, it might be helpful. Yeah.
It might give some details about the transported embryos, right?
Yeah. Yeah.
I believe. Would you also care that you need to send also or enclose with the documents that the followed protocol for vitrification and the
Yes.
following, because they may the received the center they're receiving these embryos, they might use different media or different device.
Yes, that's true. So that's just the way we do it. So we put the device we used for the vitrification and the kit we used for the vitrification. And I think it's really important to know, so which system should you use to thaw it, or can you use your system you use in your center? So comparing the instructions and the constitution. Yeah.
Right. So there is a comment about in USA regulatory bodies require two unique identifiers on the label.
Yeah.
I believe this should be it's the same case, I believe, like globally, because we need more than one item to identify. Is that
Yeah.
right?
Yeah.
Right. There is another question, I believe, in the chat part. Right. I don't. Okay. So there's a question. Do you have any information or statistics on X-rays during transport? does it affect the survival rate for egg, sperm, embryos? Some companies like DHL say they X-ray them for a few seconds and are not able to avoid it because of the international shipping.
Yeah, international shipping. So I've got experience from our cryobank, and there we put a label on it, don't X-ray. And hopefully it works. And it's just the same for cord blood. So we have also got a cryobank for cord blood at the university, and they do the same for worldwide shipping. And I think it's advisable to put a sign on it. So no X-ray, because this is human tissue and it should be transplanted or transferred, for example. So I would try to explain what's inside the container.
Right. So also if we provide some description about what is
Yeah.
in the container, it might help to avoid X-ray.
Yeah, I think so. Yeah.
Right. Was a good question. There is another question about storage. Do you recommend the storage in liquid nitrogen or above for vitrified probes?
So we really store in the liquid nitrogen phase, the vitrified samples, and we try to have about 80% filling in the tanks all the time. So a minimum of 80% filling level. And I think it's advisable to do it that way to be sure about that. So you can store in the satured phase, but it needs to be satured phase. And then it will be below minus 140 degrees Celsius. And that's the important temperature. Yeah.
Right. I think this being discussed, but there is a question about like a special and scheduled routine for periodical cleaning and sterilizing the containers.
Yes, you can do that. You can sterilize the containers once you just bought them, for example, during the qualification phase, for example. Or perhaps if you've got enough containers or supernumerous containers in your center, you can just change between the tanks, for example, or have one spare tank, for example. Yeah, it's advisable to do that at the start. Yeah.
Right.
And some also do use sterilized liquid nitrogen.
Thank you. There is another question about the documents. What documents do we have to get from the fertility centers not located in EU, which ask for cells from one patient?
So, which documents? So, we need the acceptance of the other center. Or we need to know that they can work with the tissue or with the cells. And I think also we need the patient's consent. So we need to be allowed to send it there. And it must be signed by the patient. And then all the documents you always need. So the serology and so on. Yeah. The normal transport protocol with the kit and yeah, which specimen is cryopreserved and sent to the other one. Yeah.
Right. That's actually bring me to the question. Do you think that every center they need to handle the transport, or it's better to leave the transport company to deal with the requested documents if they ship it internationally, so different regions between Europe and USA or North America or like other regions. So probably, as you mentioned, there is a different regulations and required documents from regulatory bodies. So what do you think?
I think sometimes it's really too difficult for the transport companies. So they should be specialized. So there are also medical logistic companies, for example, and that might be helpful for international transport, for example. And I think, but it's on the center's responsibility to have the documents about the patient's serology, for example. So I won't hand over the serology to, for example, a transport company, you know?
Mm.
And I think they can help you, for example, with the customs office and all the documents you need for this, but
Right.
not the complete documentation.
Okay. Another question, what if receiving country has a requirement that commercial solutions are required per the SOP, but what is the particular warming solution is not available in the country? What is your suggestion or experience?
It might be possible to also send just an aliquot of the thawing kit, for example. And it would be advisable really to explain the customs office why you send it there.
Right. So you mean that if we take the media and also we ship it,
Yeah,
it's
yeah,
used for certification of this because it's not
yeah,
available in this region,
yeah.
right? That might be a solution, yes. The next question, is there an ideal type or size for of storage tank that would be ideal for long-term storage over 10 years?
An ideal size, I don't think so. So all of the storage tanks work well and long-term wells too. But I think there might be just a problem with your assurancy. So in Germany, I think it's about 2 years now, and we need to change the containers in between 5 to 10 years.
Five
So
to 10.
then, yeah, 5 to 10 years lifetime in center, yeah, and then change the tank again.
So I believe that tanks should be used according to what is the recommended from the provider, probably to
Yeah,
and
from the provider and from the assurancy as well. Yeah,
yeah.
yeah.
Mhm. All right.
But regarding the size, it doesn't matter. So it can be 30 liter or 50 liter. It doesn't matter.
Right. So there is a question, and this was actually a comment, not a question. It's There is a comment from it says, unfortunately, there are no uniform rules here in Germany. It's is that like I believe what is meant to be said is we don't have certain rules for shipping
Yeah,
these.
and that's a pity. It would be easier for us all to have certain rules and certain guidelines for shipment. And in Germany, especially, yeah, we've got different districts, for example. So we've got yeah, central legislation and then district legislation, and yeah, these are differing sometimes, and that might be a problem. So it's really easy to have fixed guidelines and fixed rules for the shipment. Yeah.
Right. I believe that there is no remaining questions. But I have actually a question. What do you think, or how you think the best way that we need to monitor the performance of the tanks in the clinic if they are like still performing well, the evaporation rate? So how usually you monitor your tanks in the clinic?
So we have got a daily visual observation of the tanks because we work 7 days a week. And what we also do, we have samples and probes for the temperature and for the filling level. And we also support this by manual measurement.
Mm-hmm.
Yeah, that's our way how we do with that. And at the moment, we've got about 10 tanks to observe every day.
Right.
Yeah.
Right. Um, uh, this is probably maybe the last question. So there is a question: would it be possible to ship with dry ice if we're being used with the patient that very next day?
No. So no dry ice because it doesn't have this temperature. So you need liquid nitrogen or the dry shipper. Yeah, no dry ice. That's below minus 100 degrees Celsius, and that doesn't work. So the samples will get damaged.
Yeah, I agree.
Yeah.
So there is a question from Mitchell. It's what do you think the future of weight measurements are?
Yeah, future of weight measurements. So in Germany, especially, that's a very new system to measure the weight of the storage tanks, for example. So it's easy to measure the weight of the transport tank because it's not that heavy, so it's about 11.3 kilogram. But there is a monitoring system that got last year, I think. Yeah, you can buy it since last year, and that's also possible to monitor your storage tanks. And yeah, it weighs the tanks, I think, every hour. And then you can monitor that and see how much liquid nitrogen evaporates, for example. Yeah. And yeah, it's a nice system, but it's also very expensive.
Right. All right. So there is a question: what about the dry ice to transport sperm?
Yeah. So I wouldn't do it that way. We always ship in the dry shipper. So also the sperm and the slow frozen specimen. And yes, you will see that, yeah, the outer surface just a thaw. So it's always recommendable to have it below minus 140 degrees Celsius, even if it's slow frozen, and even if it's about 1 milliliter perhaps for sperm. So always stay below the minus 140 degrees Celsius.
Because probably the dry ice is usually have a different temperature.
Yeah, it has. Yeah.
Yeah. Right. So I believe that there's no more questions, and I think if there is anyone will have questions later that they can submit it to Irvine website, right? And right.
Yeah.
Okay. Thank you very much, Dr. Dunya, for this enlightening presentation. It was very interesting talk. Thank you very much.
Thank you very much. You're welcome. Then stay healthy and take care.
Yeah, hopefully everyone stay safe. Thank you very much.
Thank you.